Hello radiographers, hope you are doing good. Let's start with the patient positioning. So in this case I have used flexible large coil for shoulder joint because dedicated shoulder coil was not available, and you can see that I have tied the coil with the strap, and half of the coil is under the shoulder and half of the coil is above the shoulder. So you can use flexible coil like this. Let's go to the console. So at first I will register the patient. From the patient register I will enter the patient name and then patient ID, and then sex of the patient, and then age, and height and weight of the patient, that is compulsory for MRI and very important. And then patient position is head first supine, and you can also give the referring physician name, but it's optional. You can see what I have entered: patient position, head first supine, and then click exam. And from the list you have to select shoulder, and a folder is made shoulder new, and then select the laterality is right because I am doing the right shoulder, and then continue. Now from the list select shoulder, and you can check the protocol and click the arrow, double arrow, and the scan will start. So first the localizer, there is two localizer. The first one is only the axial localizer, and the second one is the axial, sagittal and coronal localizer. So this first localizer, you can see there is noise in this image because this localizer didn't find the flexible coil. It's automatically scanned and scanned with the table coil. So for second localizer I have to select the flexible Lars from the system. So I am selecting flexible Lars, and from the QE I am selecting coil memory so that the software can memory this coil for the rest of the protocols. Now I will drag the slice for the second localizer, and I will angle the coronal plane according to the glenohumeral joint. So now the second localizer is running. So I will plan on the next protocols on this second localizer. This second localizer gives me three images: coronal, sagittal and axial. So now I am planning for T2 transverse, and for this I have to plan on the coronal and sagittal images. So drag the positioning block over the shoulder joint, and keep in mind that the acromioclavicular joint should be included, and the slice will be parallel to the head of the humerus and the glenoid bone of the scapula. I am copying the slice planning for the axial, and now I am planning for coronal image. For coronal I am planning on the axial images and sagittal image. You can see that I am planning on the axial image, and the slice that I am angling is parallel to the humeral head and the glenoid bone. So this is the angle for coronal image. Now I am drag the proper image. I have dragged the property to axial image so that I can see that the shoulder joint clearly, and I can plan over it. You can see that on the T2 axial image the coronal slice is parallel to the shoulder and head of the shoulder and head of the humerus and the glenoid bone of the scapula. So this is the planning. So you can see in the parameter card that the slice thickness is 3 and slice number is 20 and the field of view is 170. So now click apply after completing the planning, and rest of the coronal protocols have copied this planning, so no need to plan for them. And now I have to plan for the sagittal. So I will choose PD fatset sagittal from the protocol list and drag it to the exam list, and now I will open it. So I will plan the sagittal protocol on the axial image. You can see that right now it's looking coronal, but if you angle the slice, then it will become sagittal. So I am planning on the axial image, to axial image and coronal image, and angle the plan so that the slices are perpendicular to the long axis of the shoulder joint or glenohumeral joint, and click apply. So now I have to check the images. So this is the first protocol that I have taken, the T2 axial shoulder joint. So I am checking it. So there is little bit of motion artifact because the patients have moved a little bit, maybe for respiration. So I have selected the series and send the series to the filming, and it's a 4:5 layout. That means the 20 images will fit in the film, and then print out. And next, this is the, I think it's T1 axial. So I will select the series and send it to the filming like the previous one, 20 axial slices fitted in the film, and just adjusting the window so that it looks good, and then print out. Sorry, that was PD transverse, not T1 transverse. So now is T2 start transverse, and this is called T2 Me2D in Siemens. So select series and send it to the filming, and zoom in little bit and drag the image to fit perfectly in the film. And this is again a 4:5 film layout. Adjust the window so that it looks fine, not so bright and not so black. And also give the reference image in each segment so that the radiologist can understand the reference line where it comes from. And now let's check out the coronal images. This is a T2 coronal, and then T2 or PD fatset coronal. This is PD fatset coronal. I have selecting the PD fatset coronal series and send it to the filming, and it's a 4:5 layout for coronal, 20 coronal images, adjusting the window and the zoom of the image. And this is a T1 coronal, and this is a PD coronal. T1 coronal and PD coronal almost look same, but there is little difference. So now I have taken the T2 coronal for filming, and zoom in the image, adjust the window. There may be some notification come from the scanner. You can skip it and click by clicking OK. I am adjusting the window so that it looks perfect. I always take time during this process. I don't know why I am not satisfied earlier. And then PD Corona I have selected and sent it to the filming, and I have put the reference images at the bottom, at the right bottom corner. You can see. So 3 coronal sequence I have made for filming and then print out. There is 3 film that I am printing. One is PD fatset coronal, or one is T2 coronal, and one is PD coronal, and then PD fatset sagittal. This is the PD fatset sagittal image that I am going to print. Select the series. I am rotating the image a little bit by some few degrees, 10 degrees, so that it looks straight, and send it to the filming. For sagittal I have to change the layout for 5x5. For this, select the folder, patient folder, and select 5x5 so that 25 sagittal images fit in the film. And adjust the window. And adjust the zoom of the image, and then print out. So thanks for watching. Hope you learned something. If you like this video, please hit the like button and comment me, and don't forget to subscribe this channel. Thank you.